Hey guys, it's Rica. What is up? I'm back with another video. So for today's video, I'm going to do a what's in my work bag nursing edition. I'm a newly qualified nurse and I just thought I'll do a video for you guys because if you're like me, I'm very nosy. I like watching this kind of vlogs on YouTube and I hope that you'll enjoy this video. So let's get started. This is my bag. This is actually like a pack bag. It's quite big, but honestly this is very good and it's very handy as a nurse. I bought this bag in Amazon. So this is the crosser bag. I will put the link in the description box below if you're interested to buy this bag. They've got different colors as well, but I've just bought the black because it's nice and it looks sleek. So it has a handle obviously there, and you could actually clip it if you want to just do that, but then I don't usually use this. I use a proper pack bag just to support my back really. So it also has a strap at the back where you could put this on the suitcase. So in the side of my bag you could put obviously your umbrella or your bottle of water. So I've just got my water bottle here. This is very good. I don't usually put a hot water on this, but my stepdad used this when he went hiking and it kept the water hot. So this is really good, but I just prefer my water cool. And yeah, it's just R, my initials, because obviously my name is Rica. So let's start from the front here. So in the front I just got my easy access when I'm at work. So I put this in my locker and I just prefer all the stuff that I use at work will be at the front. So I've just got my hand cream, anti-wrinkle. But this is my mom, so I just got it from hers, and then I would just fill it up with some hand cream. Oops, that's that one. That was Nevia. And I've just got this lip balm as well. This is very good for having a chapped lips like me. So I use this at work because the air in the hospital dries your lips out. So this is very good. You need to have a lip balm in your bag. And then I'll just pop that there. And then the next one, I just got a pen holder which I bought on eBay. So I put this in my nursing pocket just like that and just put all my pens. So this is just the pen that I've got, multicolored ones, because in my handover I prefer to use a different color in my handover so that when I'm handing over to the nursing staff on duty for the night shift or the day shift, I know what's what, and different colors just, you know, just organize your handover really. It helps me anyway. And then of course I've got my highlighter to highlight in my handover. And so the highlighter is very handy for the drug charts as well, because if they're under 50 kilogram, I would just highlight that they need to have at least 500 milligrams paracetamol in that 1 gram because of their weight obviously. So sometimes I would ask the doctor to prescribe and they would automatically put 1 gram instead of 500 milligrams of paracetamol. So that is very handy. And of course I have my surgical scissors. This is very handy when you take down dressings, so that is very good. And what else is in here? Of course I got my nursing badge. I just have that NHS reel, and that's me. I like this picture actually. I took this picture with my boyfriend and it's very good. It looks cute. And I've just got a Sharpie, a black Sharpie here. So this is just a mini Sharpie. This is very handy when you put the name of your patients in the board, and also this is very handy when I mark the drains of my patients, like if they have a surgical drain, and then I would just mark it there to say how many mils has been drained over the past 24 hours. This is also good for marking the patient's dressing, especially when the wound is oozing. So for example, if they've got the dressing there and they have a tiny ooze of blood, I would just mark it there, and then I would hand that over to the doctor, and then the next day we will see that it has gone over the marking. So that will just indicate something. Maybe the doctor will ask to stop anticoagulant medications. So yeah, that's that one. I'm sorry if I'm blabbing about nursing stuff, but this is why I've got a Sharpie in my nursing badge. And then the next one, I just got my spare pen. And then the next one, I've just got this pupil gauge. So that's that one. So obviously with our patients, we've got general anesthetic, different kind of blocks. Sometimes our patient will react to the anesthetic or the medications that they're on. So this is just handy to check their pupil gauge and if it is responding or not responding. And of course, it has the different sizes of the pupil or iris. Next one is I just got my nursing watch. It has my name on, Rica RN. I got this from my mom when I graduated. So this is very, again, handy. Everything here is handy. So obviously I just put it like that in my uniform, and then I would just flip it and check the time. Especially when I check, you know, the respiratory rate or heart rate or anything like that. So that's very handy for me. And what else? There's nothing. Some pennies, and that's the front bit done. And let's go to the main. Oh, I forgot to tell you, you could also charge your phone here actually, if you want to, but I don't use it, so I've got my own power bank with me. So it has a different dividers. You can see that it has two different dividers there. I could actually put my pen here in the middle, and it has a zipper here if you want to keep something. Like for example, sometimes I'll be wearing my ring at work and I will just put it here just to keep it safe, and my earrings as well, or my necklace if I forget to take them off before I go to work. And then of course I have different dividers here as well. Oh no, the other side, here and here. So if I were to use this traveling, like in the airport, I would put my laptop here, and I would put my iPad in this smaller one. So let's start from here. I've just got a mini notebook. So I've got all my passwords in here, and this is very cute. I got this from Amazon. It's just a smiley notebook, and then all the pages has different, some of the pages have different colors in them. And I just got my password in here for the hospital computers. And also it has, every pages has different codes. So this one, again, if you love tomorrow will be fun. I think it's basically the same. It has a smiley on the pages as well, which makes your mood lift up a bit if you're stressed at work. So yeah, and I've also got my, what else is in here? I'll show you a page. On this blue page, I've just got after surgery observation. So observation means, you know, the blood pressures, the heart rate, the respiratory rate, the oxygen saturation. So you have to do that for 30 minutes times 4, and then hourly twice, and then 2 hourly 4 times, and then 4 hourly 6 times. This was when I first started, but now I know it from my head. And of course everything here is just and of course I've got my calculations here. So when you calculate medications, if in case I forget, I just have this here as a reference. So that's very good. So I'll just put that back. In the second pocket, I've got a nursing and health drugs, so survival guide. If there is any medications that I wasn't sure of, so I will just click onto here, and it will say what kind of medication it is and what's the use for it and the side effects of the medication. So that is just a pocket one. I can put this in my nursing pocket as well if I want to. And then on the middle bit, because I don't have anything here on the middle bit, I just got my pencil case. This is just a unicorn pencil case because it's cute. So I just got different types of pens there, and highlighters and pencil. And I have this Tip X that I don't really use at work because we're not allowed to rub anything out with a Tip X. And highlighters, I've got a ruler, I've got a rubber, I've got some glue stick. I don't know why, but yeah, this is just in case if I need them. And then I've got some, oh, And also there's another pocket in here actually. This is where I put my spray, my perfume. This is just an L perfume, very seductive. I usually get the Victoria's Secret one, the Passion something, but then they ran out, and then I didn't like any other Victoria's Secret perfume, to be honest with you. So when I saw this, and it's the same price as the Victoria's Secret, and it smells very good. It's similar to the Passion Victoria's Secret, which is why I got this one. So that's that, because you just need to freshen up, especially, you know, when you're working in the ward and you would just running up and down the corridor and you would just sweat. So it's just nice to just freshen up a bit, but not too much though, because obviously some of our patients are sensitive to some perfume, or if they're asthmatic, we need to be careful with that as well. So the next is I just got my glasses. I forgot now. So this is just Specsavers glasses, the normal one. So I usually wear this when I'm driving or at night shift, because at night shift my vision is much more blurry, because obviously night shift I start from 7 p.m. to 7:30 in the morning, and it just makes my eyes worse. And I've just got my purse. I just got this small tiny purse, which is, I've got all of my cards here, my money. You don't need a big purse in the hospital really, so this is very good. And what else? Of course, I've got a gum. So I just got this Mentos gum, Bubble Fresh. This is my favorite gum. And now that we have a mask, you smell your own breath, which is not very nice, especially when you had food that smells like, you know, that smells disgusting, like onion, if you don't have a toothbrush with you. So gum is just very handy. This is my second bottle now. Here I just got this foaming hand sanitizer. So this is very good. I prefer this than the, see, you can see there, it's foam. Oops. I prefer this than the gel ones, because it's good for if you have a sensitive skin really. This is really good, and it smells good as well. I just got this from work actually. It was hand hygiene day last week, and I got these from them. And then I just got some Oreo biscuits. When I get hungry and I don't have time to eat, I would just get one Oreo biscuit and eat it, and then that's me for the morning or the afternoon. And then I just got this small pouch. So in my pouch I got quite a few stuff. So I just got my AirPods, I got my power bank. Sometimes I use this, sometimes I don't, because I can charge my phone in the hospital as they have a charger for the iPod Touch. So sometimes I use that, but you're not allowed to use the iPod Touch charger. So this comes handy. But then my phone is actually okay, because I don't really use my phone a lot at work, especially when I'm busy. But sometimes if I forget to charge my phone the day before I work, then yeah, the power bank is very handy. And then I've just got my charging lead. Just that. Got my charging lead. I don't have any space in my table. And then I just got my pads. If you're a girl, this is very handy. You need to have a spare one, especially if you're not regular. I'm not regular. Sometimes I don't know when I'm on, to be honest with you. But yeah, so this is very good. And I just got this hand cream. I've got this Nivea hand cream. I've got the Nivea one, and this is the bigger bottle. So this is very good. This got face, body and hands, but I use this for my hands because my hands get very dry, especially when I keep washing my hands when I see the patients, before and after seeing the patients or touching the patient. But yeah, so that's very handy for me. And then I just got a concealer. So this is a collection concealer, but you can't see the brand anymore because it faded. So this is just when, you know, when I'm on a night shift, to put underneath my eyes for some eye bags when I do my night shifts. But yeah, I don't really tend to use it that much, but it's just good to have just in case. Sometimes the photographer will come to our ward and ask for a picture for something to post on our website or our Facebook page. So it's just good to just freshen up a bit. And then again, I have another pupil gauge. So it's just, so I've got two here. This is a spare one. And then I have, I don't know why I've got this clip. It's just a random. I don't really use this, or I've never used this. I use my I just use a hair bubble. And then I've got some bobby pins and another pin for my hair, which I never use. This one I just use this one. Of course, if there's little hairs like that, I would just clip that back. And I have another nursing watch. This is just a silicone, the other one's metal. And then I have another badge wheel for my ID, in case the other one breaks. And then I have a key ring, I don't know why. And then I have this 2020 year of the nurse and midwife. So this is just a pin that I put in my uniform. This was last year. I got this last year. And of course, paracetamol. You need to have paracetamol, especially at work. With this, you know, you work day shifts, night shift, alternate every week, and I would just get a headache. So it's just nice to have, especially at work. We can't use paracetamol at work. You need to bring your own, which I do. And this is just a rubbish. So that's that, and that's empty. Let's just put this back. That's that done in the middle, and now we're gonna go into here, which is not much. And over here I just got this spare mask. This is just a mask that I wear for aerosol generating procedure, just, you know, to prevent getting COVID, and especially if you've got COVID positive patients, so you need to wear this along with the other PPE. So that's one, just a spare one, just in case our ward runs out. And then I've just got a planner. So this is leather. This is 2021. And I haven't used much of this actually. So because we've got our own app, it's called Me app. And that's where my rota is. So I don't really need to use this that much. This is just that, just in case if I need to, really. And then here I just got this orange folder. I know it looks horrible. This is just a folder that I have at work. I've got a lot of paperwork here. This is just a certificate of some stuff I have. You don't need to know all of this really, but I'll show you some. I just got a notepad here. So, and then I just got my COVID-19 vaccination card. So I've been vaccinated 2 months ago. Yeah, 2 months ago. So my next appointment is sometime next month. So that's my second job next month done. And then I've just got some spare papers here, sepsis screening tool. What else? Yeah, just random stuff. So that's that. I'm not gonna get into much, but this is just all the documents that I've got for work, which is important for me. So that's that. So let me just put that back, and that's it. It's empty now. That's that done. I really like this bag. I know it's quite big, but it's good because we're not allowed to use our uniform outside, so I would put my uniform inside and then get changed at work. And then over here I just got my lunch bag. So obviously this is from last week. So I just got instant noodles here. It's very unhealthy, but when I forget to make something, this is just handy for me if I get hungry at work at lunch. So I'll just put this in the microwave for 3 minutes and it's good. And I just have some crisps or chips, cheese and onion flavor. And then I'm gonna bin this. And then some orange, which is, I don't think I'll eat anymore. I'll probably put this in the bin now. So yeah, that's that one. And then just a spare spoon and fork, because sometimes we run out of spoon and fork at work, so it's just good to have your own. And that's that done, all my bag. If you're wondering where's my stethoscopes are, I don't really use the stethoscopes at work because we have our own blood pressure machine. But if I need to use a stethoscope, we got one at work, so we've got at least 10 stethoscopes, so we don't need to bring our own. But if you want to, you can, but we don't do a lot of manual blood pressure. Although I do have one. I don't bring this at work. This is just hidden here in my room. So this is just when I do manual blood pressure, when I do it for my mom. Of course, I've got my phone. This will be in my nursing pocket or probably in my bag. But then I just put this in my nursing pocket. If I need to know something, I would just search it on my phone. And we've got a very fast Wi-Fi in our hospital, which is very, very handy again for me. So that's that. So that's that done, guys. I hope that you enjoyed this, and if you have any more video suggestions, please comment down below and I will try to do some of those suggestions for you guys. And I hope that you learned something from this, like, you know, bringing your own power bank. So I hope that you enjoyed this video, and like it and subscribe to my YouTube channel and hit that notification bell so that you'll get notified when I upload something. I had fun showing you all of this, guys, so I hope that you had fun too. Anyway, see you again soon.